guys, it's Emily here from Royal Equestrian Center, and we're here with Thunder today. Thunder has a systemic infection, so he's going to be receiving antibiotics. One thing when you're working with horses, especially in a barn, it's really important to know how to give injections. Of course, you want to learn how to do these with your veterinarian, but I thought it'd be fun if I showed you, how we give an injection and quickly covered the different types of injections. So one of the very most common types of injections are called IM, so it's intramuscular. So we would go just right into the muscle, making sure that we don't hit any blood vessels. There's a few different places you can administer an IM injection. One of the most common places is the neck. Now with the neck, we do have to be very careful about where in the neck we give the injection and how we give it. So two of the most important things we want to keep in mind is up along here is the nuchal ligament. This is the ligament that is responsible for allowing the horse to lower and lift its head. And then the cervical vertebrae of the horse, which is like your neck vertebrae. It starts up here where it connects to the atlas and actually runs down sort of in a shape this way. So we want to make sure that, we're not putting the needle anywhere into where there's bone, and we want to avoid the nuchal ligament. So the easiest way is to kind of feel the horse's neck, and then there's just kind of this triangle shape right here. So this is kind of the safe zone to give a horse an injection. There's a nice big body of muscle here. You can do it also in the pecs down here. Sometimes you would do this for a foal. I've never actually done an injection in the pecs. I think it's kind of a tricky area, but it is an option. Another common spot to give a horse an injection is here in the hindquarters. So with the hindquarters, there's a few things we want to keep in mind. We have the hip bone here, so we always kind of want to find that hip bone and then draw back, and we can kind of give it in this area here. The benefit of doing an injection here is that it can drain easily. The downfall is it's easier for you to get kicked, and horses tend to really react when you give an injection here. Another spot would be in the back in the hamstrings. This is another spot that's actually often used on foals, but again, not really a spot you want to be sticking a needle into. So aside from IM injections, there are also IV injections. These are really, really important to know how to do because it can be life-saving and used in the meantime while you're waiting for a vet to come, for instance, as a colic. So an IV injection is intravenous, which would be inserted here into the jugular vein. This is a skill that requires a lot of practice and something that you need to do with your veterinarian present. But if it's something, if you're working in a barn, managing a barn, if you're, responsible for the care of the horses, that's an important skill to learn how to do. And then the last one is sub-Q, which is right under the skin. So you would tent the skin and insert the needle right under the skin so you're not going into muscle or into a vein. This is commonly used when we're using hormones and whatnot for breeding mares. Not one you'll use too often, but good to know. So there's the three types. We have IM, intramuscular, we have IV, which is intravenous, and then we have sub-Q. And it's important to know where to give each of these and how to perform them properly. So Thunder here is going to get the IM injection with the antibiotics. We're going to use the neck. So the antibiotics that we're using is called Exceed. It's really, really thick. What we're going to do when I go and put the needle in is I want to make sure, again, I'm drawing that triangle. I'm kind of finding a good spot to do it. Thunder is pretty good with needles, but if your horse isn't so good, you might want to pinch the skin, have somebody hold them. Sometimes it might need to be twitched, but hopefully not. We want them to try and make this as comfortable as we can. So I'm going to find my site. So I draw my triangle. I'm going to think about the spot. I'm going to put it in. I like to desensitize the area for a second. I just hit it once or twice. And then when I go and push the needle in, I'm going to put it in kind of like a dart. So you can see how I'm holding it here. And I'm going to go straight on. I want to make sure that I'm not going on an angle. You're fine. So now what I'm going to do is I'm going to just draw the needle back to make sure that I haven't hit a blood vessel because this is not meant to go into the bloodstream. And then I'm going to push it in. If he moves, I would then draw the needle back, and then I'm going to push some more. This stuff is hard, so it takes a little while to push it in because it's so thick. And that's it.